Congenital cardiac defects are some of the most common congenital conditions with an incidence of around 1 in 100. Considering how common they are incredibly challenging to teach with medical students due to complex anatomy and unintelligible acronyms. In particular, the visuospatial nature of these defects has meant that various high technology methods have been trialled, such as online reconstructions and even 3D printed models. These are often difficult to access and are often expensive. So considering this, we have trialled various low technology methods just using pen and paper. We offer our students simplified diagrams which can be replicated to model any of the congenital cardiac conditions. In a pilot study, in a classroom-based session, we received overwhelmingly positive feedback, with 9 out of 19 of our students specifically mentioning the diagrams as a particular highlight of the session. Considering this, we now plan to roll these sessions out on a more regular basis, including at the bedside following case-based discussions, as well as in classroom sessions. We believe that this method will improve our students' self-reported confidence in their understanding of these conditions and offer a more easily replicable means of teaching these conditions. Based on the data we received from our pilot study, we expect our sessions to show a significant improvement in the students' confidence in understanding these conditions, and we hope that our method will encourage educators to consider alternative, simpler and cheaper methods of teaching which still provide high quality education.